So for the low back, I need to figure out where the problem is on the low back and work on it. So I'm going to bring this arm here and I'm going to just go underneath. So you can relax. You don't have to lift. You can stay just relaxed down, just normal like that. Okay. So I need to find out, and I can feel that there really is no movement in his paraspinals. So I know this is hard to see, but it's really powerful. I have a lot of people that will testify to that.
One day we'll have glass table to show your work.
It's so...
No, just explain,
Okay,
please, how
so-
you can be beneficial to the seniors
Okay.
to come up in the house and do this work.
Okay, so with seniors or really anybody, it's very easy. What you do is the muscles right now of his low back are very sensitive and they're extremely tight and people are very protective. And I need to warm it up. I need to figure out what's going on. So I'm going to reach underneath and I'm going to loosen up, figure out where this is. So his muscles are falling away from his nerves. So you see where you're tight here. You feel tight. You see how this is how tight this is.
Yeah.
And this is very tight. Now I want you to relax and breathe normal. There you go.
Okay,
Yeah. Better.
okay,
Good. So you just relax. All your weight, you just relax as much. Okay. Because my hands are fine. My hands are fine. You can tell him in Russian.
What exactly?
And tell him that my hands are fine and he can relax his body.
Расслабься, сейчас его
I
руки.
see, I see.
Okay. Я understand you.
I'm gonna have to work on my Russian.
No.
So,
My English not so good, no, but I understand.
everybody here speaks Russian.
Russia is very difficult
Yeah.
language.
Now, this feels tight to you when I work in here? Are you okay? Is this
Yeah,
pressure
I
okay?
need more practice. Speaking English.
Mhm.
I go to school, but no practice.
So, I'm able to now. Now, Yuri, he can be on his side like you were putting him on his side, right?
Yeah, whatever you want to do.
Well, so this is how I warm it up. So I'm just going to warm it up just for a couple of minutes while he's underneath. But usually it takes me about 15 or 20 minutes. With his case, it's about 20 minutes of working underneath. And when I work underneath his back, his very, very sensitive, tight muscles are very, they're causing him a lot of pain if I push on him the wrong way. So if he's lying like this, I can loosen him up and warm it up. And so when I put you on your side and when you're face down, you're gonna be so happy because it's already warmed up and loosened up. And so I'm gonna go on here and loosen him up this way. It's just that you can't see what I'm doing from underneath the body, but it's very powerful. And I've worked on seniors. Oh my God, I work at a country club where half the members are seniors. So I work on seniors all the time. Almost every day I'm working on seniors. And so here. Oh, I forgot. Now usually there's a little, hand me that thing for under his knees, that pillow over there, yeah. Usually I have something under your knees.
Pillow.
Yeah.
Okay.
Yeah, that's I usually have pillow which is softer. Okay, and you can relax here. So I can feel where the pressure is on his back. I can feel where it is, and also I can feel if there's any other lingering problems in his thoracic. I have access to loosening up his muscles in a way that doesn't hurt, but it enables me to figure out where the nerves are being hit, which part of the back is the worst, which is better. And I can tell, like, when it gets down low to his lumbar, his L3, L4, L5, S1 area in here. It feels tight, but this doesn't hurt or anything, right? It feels okay?
Yeah, it's okay.
Okay. So, all right. So now, once you warm it up, I'm going to put him on his side. So I'm going to put you on this
What?
side.
This side, eh?
Yeah.
Okay.
Yeah. Okay. Now, I'm going to give him this pillow. And I'm going to put a towel on top of here. I'm going to put this here. Okay. And I'm going to put this between his knees.
Come on, David.
You've got to make these people comfortable. They have to, seniors like comfort. People
Yeah.
like comfort.
Comfort, yeah. He's like a business class of massage.
People, so
I'm economy, but fast.
when you're getting massage, it has to be super comfortable. So I have a pillow for everything. So now I'm gonna feel both sides, and I'm gonna feel where he's restricted. So there are techniques to warm it up a little bit more and find out where exactly are the fibers. Where does it start getting tight that goes into here? So I'm going down into here, and I can feel where things just don't have any movement. This is all stuck right here. You can feel where the muscles are stuck. So it's hard to see everything on a camera, but when you roll it around and you move your hands around and I'm pulling my fingers in, you can feel what muscles are giving him the most trouble. And so here, so tight right here,
Yeah.
right?
Yeah.
So look, for instance, this muscle could be very good over here, and this could be very tight, and this could be tight. So I go in here, I figure it out, and I'm going to move it for him. So I'm going to just do this. And then you can move it. So you can move, once you warm up the muscles that are giving you the trouble, you can loosen them and then move the whole unit. So it's not like I'm working on one fiber at a time. It's you're working on a group of muscles, but you're using a technique that the body likes. So here, I'm going back into here, and I can feel where it's really bad. So here.
Yeah.
So you can now narrow it down. See, he already had his thoracic worked on, so it feels so much different now. So now I can find out where it is, and I have to move it. So here. So I'm doing it in a way that he knows that this is where it's tight. So wherever you're tight, I can discover that quickly. Here, here, here. I can feel here. Sometimes you go into here.
Yeah, you see the QL is always in spasm. This muscle is always, the QL muscle
Yes.
is always in spasm, and you have to work sometimes. And then I didn't say you're not supposed to ignore that muscle, but yeah, it's always muscle in spasm, and you need to work on that. It's so much pressure on that muscle because just think about it, the whole body sitting on this QL muscle. It's a quadratum lumborum muscle, and it's if your hips is uneven, it's always get that problem. You okay?
It's okay.
Yeah, he's good.
Yes. Now, gravity is always, when you're sitting, gravity is shoving your whole body down into your hip, and
Correct.
your glutes get squished and weak.
Correct, yes.
That's what those correction exercises strengthen up all his glutes.
Yes.
And it takes the pressure off of his lower back, too.
Okay, really good.
So this is the one side, and I can figure out what muscles are stuck and what muscles are not stuck.
Okay.
So I do this. So I'm just doing a little bit here, more here, and there, and there. I'm narrowing it down. So here.
Yeah.
So you can tell where it is, and then I'm not working super hard. I don't need to pound into him. His muscles are tight, so you just have to work with a good pressure. So should I do the other side? You won't be able to see.
No, just fine.
Okay. Okay.
If you have something else to work, but otherwise we have to drive him home because I have a client.
Oh, you do?
Yeah.
Okay.
And you got a client too.
Yes. No, that's basically how this is just part of a treatment.
Yes.
You warm it up from underneath, and you can get all the blood flow. It feels good. You take the pressure off the nerve. It doesn't hurt. You put them on the side. It's already warmed up. You loosen, and you can hunt down like a detective all the parts that are stuck, and you
Correct.
do it in the right way. It feels good, and you're not going to be in pain, and you're going to feel amazing.
So tell people where to find you and how to book
Life
you.
RX Wellness, you can call the number below, and I can evaluate it. I've done thousands of people over the last over 20 years, and so we're here for you. We go to people's houses, and we have a clinic here in Glendale, and if you have any questions, just call, and then I could get back to you, or someone else can. All right, thank you. Good to meet you.
Okay, so let's get up and see how he feel and what's the difference right now.
I should balance out.